You were probably taught that bleeding gums mean you need to brush harder, but the truth is far more alarming than anyone ever told you. What if I told you that receding gums are not just a dental problem, but actually your heart sending you an urgent warning signal? Stay with me, because what I am about to reveal today could save your life and protect your heart from silent damage happening right now. Gum disease, also called periodontal disease, affects nearly 70% of adults over the age of 65 in countries worldwide. Most people believe that swollen, bleeding, or receding gums are simply signs of aging, or the result of brushing with too much pressure. But researchers have discovered that chronic gum inflammation is actually a direct pipeline for dangerous bacteria to enter your bloodstream. Once these bacteria travel through your blood, they attach to the walls of your arteries, triggering inflammation and plaque buildup there. Why do some people keep healthy gums and strong hearts, even in their 70s, while others face heart attacks and gum loss much earlier? What is the one mistake that millions of people in our generation make every single day that accelerates both gum disease and heart disease? I will answer all of these questions step by step, and I will also share 7 warning signs your mouth is showing you right now. Please leave a comment telling me where you are watching this video from, and let us begin uncovering the truth your gums have been trying to tell you. Think of your gums as the seal around a window frame, keeping the outside world separate from the inside of your home and your body. When that seal breaks down, bacteria that normally live in your mouth can slip through tiny openings and enter your bloodstream directly. These bacteria do not just disappear, they travel through your veins and arteries, and some of them settle inside the walls of your arteries. Scientists at the University of Bristol in the United Kingdom found a specific gum bacteria called Porphyromonas gingivalis inside arterial plaques. This means the same germs causing your gums to bleed are also contributing to the hardening and narrowing of your arteries over time. Your immune system responds by sending inflammatory chemicals to fight these invaders, but that inflammation damages the artery walls even more. Now that you understand how gum bacteria can directly harm your heart, let me walk you through the 7 warning signs to watch for. Each of these signs is your body trying to tell you that inflammation is spreading, and your heart may already be paying the price for it. Warning sign number 1. Your gums suddenly become sensitive to hot drinks, cold foods, or even breathing in cool air through your mouth. Most people dismiss this as a normal part of getting older, assuming their teeth are simply wearing down with age, and nothing can be done. But gum sensitivity is actually one of the earliest visible signs that the protective tissue around your teeth is thinning and pulling back. When gums recede, they expose the roots of your teeth, which do not have the hard enamel coating that protects the crown of the tooth. This exposure makes your teeth feel sensitive, but more importantly, it signals that chronic inflammation is already damaging the soft tissue. According to researchers at the American Academy of Periodontology, gum recession is rarely caused by brushing alone, but by long-term inflammation. That inflammation releases enzymes that break down collagen, the protein that holds your gum tissue firmly in place around each tooth root. The same inflammatory process that destroys gum collagen also weakens the collagen inside the walls of your arteries, making them stiff and fragile. A study published in the Journal of Periodontology found that people with moderate gum disease had significantly higher arterial stiffness than healthy controls. If you notice new sensitivity when drinking your morning coffee or eating ice cream, do not ignore it or switch to a desensitizing toothpaste alone. Instead, see it as an early warning that your body is under chronic inflammatory stress, and take action to reduce that inflammation immediately. Simple steps like flossing daily, eating more anti-inflammatory foods, and visiting your dentist can stop this process before it reaches your heart. Remember, sensitivity is not just about comfort. It is your gums telling you that the protective barrier around your teeth is breaking down fast. Addressing gum sensitivity now can prevent not only tooth loss later, but also reduce your risk of heart attack and stroke in the years ahead. Do not wait for the sensitivity to become unbearable. Treat it as the urgent signal it truly is, and protect both your smile and your heart. Warning sign number 2. You have persistent bad breath that does not go away even after brushing your teeth, using mouthwash, or chewing gum. Many people believe bad breath is simply caused by eating garlic, onions, or skipping a brushing session, but chronic bad breath tells a different story. When bacteria multiply below your gum line in deep pockets that your toothbrush cannot reach, they produce sulfur compounds that smell like rotten eggs. These same bacteria are not just causing the odor. They are also releasing toxins that trigger inflammation throughout your entire cardiovascular system. A team of researchers at the University of Florida College of Dentistry found that people with chronic bad breath had elevated levels of inflammatory markers. One of those markers is C-reactive protein, the exact same blood marker that cardiologists use to assess your risk of heart attack and stroke. When your body is constantly fighting an infection in your gums, your liver produces more C-reactive protein, to help manage the inflammation everywhere. Over time, this chronic elevation of inflammatory chemicals damages the inner lining of your arteries, making them more prone to plaque buildup and blockages. If you find yourself reaching for mints or mouthwash multiple times a day just to mask the smell, you are treating the symptom but ignoring the cause. The real solution is to eliminate the bacterial colonies hiding below your gum line, which requires professional cleaning and daily flossing at home. Do not feel embarrassed about bad breath. Instead, recognize it as a red flag that your immune system is working overtime to fight an infection. That infection is not contained to your mouth. Every time you swallow, bacteria and their toxins can enter your digestive tract and bloodstream. Studies from the American Heart Association have shown that people with severe gum disease are nearly twice as likely to suffer from coronary artery disease. So the next time you notice persistent bad breath, do not just cover it up. Schedule a dental checkup and commit to a daily flossing routine. Your breath is not just a social concern. It is a window into the health of your heart, and taking action now can add years to your life. Warning sign number 3. Your gums bleed when you brush your teeth or floss, and you have been told this is normal or just means you need to floss more. The truth is that healthy gums should never bleed, no matter how much pressure you apply, because healthy tissue is resilient and well supplied with blood. When your gums bleed, it means the tissue is inflamed, swollen, and filled with immune cells that are fighting an active bacterial infection right there. Every time your gums bleed, you are creating thousands of microscopic openings, through which bacteria can pour directly into your bloodstream in seconds. Researchers at the University of North Carolina found that a single episode of toothbrushing in someone with gum disease can release bacteria into the blood. Once in your bloodstream, these bacteria travel to your heart, your brain, and every other organ, triggering inflammation wherever they land and settle. A landmark study published in the New England Journal of Medicine showed that people with periodontal disease had a 44% higher risk of heart attack. The bleeding is not just a nuisance. It is a sign that your immune system is losing the battle against infection, and your heart is already being affected. Many people stop flossing because it causes bleeding, but that is exactly the wrong response, because flossing removes the bacteria causing the bleeding. Instead, floss gently every single day, and within 1 to 2 weeks the bleeding should decrease as the inflammation begins to resolve naturally. If bleeding continues after 2 weeks of daily flossing, it is time to see a dentist for a professional cleaning and evaluation of your gum health. Do not brush off bleeding gums as a minor inconvenience. Treat it as the serious warning sign it is, because your cardiovascular system is at stake. Remember, every time your gums bleed, bacteria are entering your blood, and those bacteria are heading straight for the walls of your arteries. Stopping the bleeding means stopping the infection, and stopping the infection means protecting your heart from silent damage that builds up over decades. Warning sign number 4. Your gums appear swollen, puffy, red or shiny instead of firm, pale pink, and slightly textured like the skin of an orange peel. Healthy gum tissue should hug your teeth tightly and have a matte surface, but inflamed gums lose their firmness and take on a glossy, swollen appearance. This change in color and texture is caused by increased blood flow and fluid buildup as your immune system rushes white blood cells to the infected area. The same inflammatory chemicals that cause your gums to swell also circulate through your entire body, affecting your arteries, your heart, and your brain. A study from the American Academy of Periodontology found that inflammation in the gums raises systemic markers of inflammation throughout the entire body. One of those markers is interleukin-6, a protein that promotes the formation of blood clots and increases the risk of heart attack and stroke significantly. When your gums are chronically swollen, your body is in a constant state of low-grade inflammation, which accelerates aging and disease in every organ. Many people ignore swollen gums because they do not cause pain, but pain is not a reliable indicator of danger when it comes to chronic inflammation. In fact, gum disease is often called a silent disease because it can progress to severe stages without causing noticeable discomfort until it is too late. If you look in the mirror and see that your gums are red, puffy, or shiny, do not wait for pain to appear before taking action to reverse it. Start by flossing daily, brushing gently for 2 full minutes, and rinsing your mouth with plain water after every meal to reduce bacterial buildup. Also consider adding more anti-inflammatory foods to your diet, such as leafy greens, fatty fish, olive oil, berries, and nuts, to calm inflammation naturally. Schedule a professional cleaning with your dentist, because only a trained hygienist can remove the hardened tartar below the gum line that brushing cannot reach. Swollen gums are not just a cosmetic issue. They are a visible sign that your immune system is overwhelmed and your heart is under silent attack every day. Warning sign number 5. You notice pus oozing from your gum line, or you taste a salty, metallic, or foul flavor in your mouth, even when you are not eating. Pus is a mixture of dead white blood cells, bacteria, and tissue debris. and it means you have an active infection that your body is struggling to control. When pus drains from your gums into your mouth, you are literally swallowing bacteria and toxins that can enter your digestive system and bloodstream immediately. This is not just a local infection. It is a systemic threat because those bacteria can travel to your heart valves, your brain, and your major arteries. Researchers at Columbia University found that people with severe periodontal disease had detectable levels of oral bacteria in their carotid artery plaques. The carotid arteries are the main blood vessels that supply oxygen to your brain, so an infection there can increase your risk of stroke dramatically. Pus is also a sign that the bone supporting your teeth is being destroyed because the infection has spread from the gums down into the deeper structures. Once bone loss begins, it is very difficult to reverse and tooth loss becomes almost inevitable unless the infection is stopped and treated immediately. If you see pus or taste something foul in your mouth, do not delay. Contact a dentist as soon as possible for an urgent evaluation and treatment plan. In the meantime, rinse your mouth gently with warm salt water several times a day to help reduce bacterial load and soothe the inflamed tissue temporarily. Do not use alcohol-based mouthwashes because they can dry out your mouth and kill beneficial bacteria, making the problem worse in the long run instead. Pus is your body waving a red flag, telling you that the infection has reached a critical level and is now affecting your overall health and longevity. Ignoring this sign can lead not only to tooth loss, but also to serious complications like heart valve infections, abscesses, and even sepsis in rare cases. Take pus seriously, act quickly, and understand that treating this infection is not just about saving your teeth. It is about protecting your heart and life. Warning sign number 6. Your teeth feel loose, are shifting position, or new gaps are appearing between teeth that used to fit together tightly and perfectly. Loose teeth are a late-stage sign that the bone and connective tissue holding your teeth in place have been significantly damaged by chronic inflammation. The same enzymes and inflammatory chemicals that destroy gum tissue also break down the bone in your jaw, causing teeth to lose their stable foundation. This bone loss does not happen overnight. It is the result of years of untreated low-grade infection and inflammation that silently eats away at the bone. A study published in the Journal of Clinical Periodontology found that people with severe bone loss around their teeth had much higher rates of atherosclerosis. Atherosclerosis is the buildup of fatty plaques inside your arteries, and it is the leading cause of heart attacks, strokes, and peripheral artery disease worldwide. The connection is clear. The same inflammatory process that destroys bone in your jaw also accelerates plaque buildup and hardening of your arteries everywhere. If your teeth are shifting or loose, it means the infection has been active for a long time, and your cardiovascular system has likely been affected too. Do not assume that loose teeth are just a normal part of aging, because healthy teeth should remain firmly anchored in your jaw for your entire lifetime. See a dentist immediately for a comprehensive evaluation, including X-rays to assess the extent of bone loss and determine the best course of treatment. In some cases, deep cleaning procedures, antibiotics, or even surgery may be necessary to save the teeth and stop the infection from spreading further. At the same time, work with your doctor to assess your cardiovascular health, because treating your gums alone is not enough if your heart is already compromised. Loose teeth are not just a dental emergency. They are a whole-body emergency, signaling that inflammation has reached a critical and dangerous level. Taking action now can prevent tooth loss, reduce your heart attack risk, and give you many more years of health, independence, and quality of life. Warning sign number 7, and this is the one that surprises everyone. Your gums are receding, exposing the roots of your teeth, and you were told it is because you brush too hard. For decades, dentists have told patients that gum recession is caused by aggressive brushing with hard bristled brushes, and while that can contribute, it is rarely the main cause. The truth is that gum recession is most often driven by chronic inflammation, smoking, teeth grinding, hormonal changes, and poor blood flow to the gum tissue. When your gums are inflamed, the tissue shrinks and pulls away from the teeth, creating pockets where bacteria can hide and multiply without being disturbed. These deep pockets become breeding grounds for even more dangerous bacteria, which release toxins that enter your bloodstream and travel straight to your heart. A groundbreaking study from Harvard School of Dental Medicine found that people with gum recession had significantly higher levels of arterial plaque than those with healthy gums. The researchers concluded that gum recession is not just a cosmetic problem, it is a visible marker of systemic inflammation and cardiovascular disease risk. Many people with receding gums also have other signs of poor circulation, such as cold hands and feet, slow wound healing, and fatigue, because inflammation affects blood vessels everywhere. If you have been brushing the same way for years and suddenly notice your gums pulling back, the real cause is likely inflammation, not your brushing technique. Switching to a soft bristled brush and using gentle circular motions is important, but it will not reverse recession if the underlying inflammation is not addressed. You need to reduce the bacterial load in your mouth by flossing daily, eating an anti-inflammatory diet, avoiding tobacco and managing stress, which also fuels inflammation. Receding gums are your heart crying for help, because the same process destroying your gum tissue is also quietly damaging the inner lining of your arteries every single day. Do not ignore this sign, or assume it is purely cosmetic, because receding gums are one of the clearest visible warnings that your cardiovascular system is under attack. Protecting your gums means protecting your heart, your brain, and your future. So treat gum recession with the seriousness and urgency it truly deserves. Now that you know the 7 warning signs, let me give you practical steps you can start today to protect both your gums and your heart at the same time. First, floss gently before brushing, not after, because flossing loosens plaque and food particles, so brushing can sweep them away more effectively than before. Second, brush for a full 2 minutes using a soft bristled brush and small circular motions, never sawing back and forth, which can damage delicate gum tissue. Third, clean your tongue daily with a scraper or the back of your brush to remove bacteria that cause bad breath and contribute to overall bacterial load. If you're taking blood thinners or immune-suppressing medications, talk to your doctor before starting any new oral health routine, because some treatments may interact. Also, if you experience severe gum pain, fever, or swelling, seek professional care immediately, because these signs may indicate a serious infection requiring antibiotics. Thank you so much for watching, and if this video opened your eyes, please leave a like, share it with someone you care about, and comment below. There are 2 more videos on your screen right now that will help you protect your health even further. So click one and keep learning with me. There are 2 more videos on your screen right now that will help you protect your health even further. So click one and keep learning with me.